Congressman Bill Cassidy of Louisiana is the author of the Medicaid Accountability and Care Act. He joins us now. Congressman, great to see you. Essentially, the first version of your bill to reform Medicaid died in Congress. Why will this one move, you think?
Well, one, it's a different concept. One, it puts patients first, and two, it kind of institutes in Medicaid principles that are common in every other major private insurance program. And so, but this is Washington. You've got to kind of change a paradigm. What? Put patients first. Two, do what the private sector is doing more successfully. That's what we're trying to introduce. It may take a little bit for it to gain traction.
But be more specific about how you change the way that Medicaid is paid for or funded to the states.
Yeah, Medicaid is actually 4 different programs, if you will: pediatric care, adult care, long-term care, and blind and disabled. Very different cost structures for each of those. And so if you have a state with lots of disabled, you get about $50,000 per disabled. Whereas if you have a state with lots of children, it's only $1,500 there. Let's break these populations apart and compensate states upon the number they have within each category, since the cost basis is so different.
Do you think that it in some way, though, could encourage the states to enroll more people on Medicaid?
No, because the state still has a portion which they are picking up. And so the state is not going to make money in the real sense. But what it does do is it gives the state a fixed amount. So no longer is it what it is today, which is cost plus contracting. The state gets paid as much as they bill. Rather, it says the state, this is how much you get for this population, manage them like a private insurance company will, putting up your dollars, but focus on patient outcomes. At the same time, you can also focus on your budget.
Well, how is this different from another Republican idea of block grants to the state, something that Congressman Paul Ryan has pushed forward?
Yeah, block grants, if you will, say what has the state received in the past, that's what they will receive in the future. It doesn't sensitively account for the fact that populations grow and shrink. It also doesn't account for the fact that some states have been gaming the system. Some states have been taking federal tax dollars for the benefit of the state, really with poor outcomes associated with it. I can give you lots of examples of this. This builds in the accountability that requires a state to show that what they're doing with federal tax dollars actually improves patient care.
Speaking of federal tax dollars, before we go, about the Medicaid expansion in Obamacare, in the Affordable Care Act, there's much of a fight going on. State of Florida, one example, the governor there signing off on this expansion, and then the GOP legislature saying, no, thank you, we're not stepping up for this. Are we entering a period where there's going to be a major quagmire in implementing Obamacare, and people in these states, if the states don't sign on to the Medicaid expansion, the people in these states will go uninsured?
Well, first, these people in the states presumably are already uninsured, but actually, many of the people that go on Medicaid after a Medicaid expansion will be dropping their private insurance and getting onto Medicaid. It's predicted as many as 65% will be dropping their own insurance to go on Medicaid, number one. Number two, Medicaid is a broken system. We've not updated it substantially since 1965. No one would fashion Medicaid now as it was back then. We would do it differently. And so I think the kind of way states are approaching this reflects the fact that it's a broken system. They're afraid that if they do the expansion, you put in place forever a broken system, and that's not going to be good for patients, not going to be good for taxpayers.
Congressman, good to see you. Thank you so much.
Thank you.
Congressman Bill Cassidy.